Mr. Rogers, do you know where you are? Fortis Hospital. Do you know why you're here? Wound, okay. And do you know what date it is today? Okay. The patient is alert and oriented ×4. I'm going to shine this in your eyes and follow the pen for me. Okay. Pupils are equal, round, and reactive to light and are able to accommodate. I'm going to check the oral mucosa. Oral mucosa is pink, moist, and intact. Going to check for skin turgor, and it is non-tenting. Okay. Mr. Rogers, have you had a cough? Yes? Okay. Is it productive or non-productive? It's productive. Okay, and the color is white. The consistency is frothy and thin. Okay, and about how much, if you could fill up a little medicine cup? 5 milliliters. Okay. I'm going to listen to 8 places on the front and 10 on the back. I'm going to first inspect the thorax, and the chest rises symmetrically. Okay. Lung sounds are clear, and I would also listen to 10 places on the back and find the same findings. Respirations are even and unlabored. Okay, so next we are going to listen to the heart, starting with the second intercostal space to the right, which is the aortic. S1, S2 heard. Second intercostal space to the left is the pulmonic. S1, S2 heard. Third intercostal space to the left is Erb's point. S1, S2 heard. Fourth intercostal space to the left is the tricuspid. S1, S2 heard. Fifth intercostal space mid-clavicular line is the mitral. S1, S2 heard. And I would flip this over and listen for a full minute for the apical pulse. Okay, so I listened for a full minute, the apical pulse, we'll say is 96. Okay. I'm going to start by assessing the brachial pulse on both sides. +2 regular. Radial pulse on both sides, +2 regular. Going to check for capillary refill on both sides. It is less than 3 seconds. Okay. Can you squeeze my hand? Okay, and then push down and pull up. Okay, so strength is a +5 equal bilaterally. Okay, so I'm going to assess the IV site. The IV site, the dressing is clean, dry, and intact. It is dated. There's no redness, swelling, or infiltration noted. Okay. Mr. Rogers, when was your last bowel movement? Last night. The color, brown. The consistency, soft, states that there's no unusual odor. And the size states as medium. I'm going to assess the abdomen. The abdomen is flat and non-distended. I'm going to start by auscultating 4 quadrants, starting with the lower right quadrant. Lower right quadrant, vowel sounds are active. Upper right quadrant, vowel sounds are active. Upper left quadrant, vowel sounds are active. And lower left quadrant, vowel sounds are active. Okay, so I'm going to palpate your abdomen. Can you tell me if you have any pain or tenderness? Starting with the lower right quadrant, upper right quadrant, upper left quadrant, lower left quadrant. And the patient states that no pain or tenderness. Okay. All right. When did you last urinate? Doesn't say. Okay. The color states with straw. The clarity said it was clear. Any unusual odor? No odor. And about how much? States a half full urinal. Any pain, urgency, or a change in frequency? Okay, none. I'm going to assess the genitalia, so I'm just going to lift this up. There are no lesions, edema, abnormalities, discharge, or sores. So I'm going to put that down. Right, we're going to move on to the legs. I'm checking for edema. All right, and there is no edema noted. I'm going to assess the overall skin. Temperature is warm, dry, and the color is appropriate to ethnicities, and there's no presence of any breakdown or lesions on the skin. So I'm going to wash my hands, put on some gloves. We're going to move down to the feet, checking for dorsalis pedis pulse on both sides, and it's +2 regular. Posterior tibialis pulse, +2 regular on both sides. I'm checking for capillary refill, which is less than 3 seconds on both sides. Can you push down for me and pull up? And the lower extremity, lower left extremity is a +4, and the lower right extremity is a +5. I'm going to take these gloves off. Wash my hands. And okay, Mr. Rogers, we are all done. I'm about to go call the doctor for you, okay?